The next item is number 5, which is an update around issues relating to mental health. Just by way of an introduction, again, this is recognised within the police and crime plan regarding the impact this is having on a daily basis with regards policing. I did establish a criminal justice and mental health forum in 2015 that does bring together colleagues from mental health trusts, the police, NHS England, and other partners from other emergency services as well. So that's proved very useful in talking about strategic issues, particularly the changes around Section 136, which I know you'll touch on in the report of the Mental Health Act, and also the forum does sort of explore a number of issues within mental health, for example, therapeutic support to victims of crime, mental health treatment orders, and support for people with multiple and complex needs. So that's just by way of a background, and I will now hand over in terms of an update report.
So thank you, Commissioner. So this is one of the topics that we have reported on several times over the last couple of years. So what we want to do today is to give you the very latest update about what's happened in the last 6 months and what ongoing work there is. Obviously, one of the things that we were pleased to hear about in the budget announcements was some additional funding nationally for mental health provision, and we are hoping that some of the work that we're going to describe today will be enhanced by perhaps some of that funding being released locally. So, Damien.
Chief, thank you. Commissioner. Straight into the report then, sir. I think the key thing to note here is the work that was actually done prior to the law change, because certainly what I don't want you to take from this report is that everything's happened since the law has changed. I think the work that was undertaken through the forum and also within the district concordats has really progressed in relation to the demand that mental health was having on the police service. I think, as you can see there from the table at page 1, we have significant demand still, and certainly what this is showing you here is those section 136 where we've gone through the mental health nurse, those people who have then been detained as per section 136 of the legislation. So we have further demand on top of this that comes through to us as calls where we will not then detain. So it's certainly not showing all in relation to the level of demand that it has on us. As I previously mentioned, the law did change in December. I'm really pleased to say since that change in law, there's only actually been 3 people detained within police cells, because that change in legislation, we were no longer considered a place of safety apart from in 2 exceptional circumstances, which I'll come on to in a moment as I go through. I think when you then move on to page 2, when you look at the demand across the districts, you can see the demand is different, but I think that is really down to the demographics of each of those districts that we serve. Very much so like crime types as well in relation to those demands. So as I mentioned, with regards to section 136, those people who we deal with, those victims who are, let's be honest, are suffering at that moment in time significant stress, when we come across them on the streets, the first point of call is that 24/7 access that we have to a mental health practitioner. What that allows us to do, which we didn't have before, is access their medical records. And what we then do is use that specialist advice whether they should be detained or whether in those certain circumstances they shouldn't be. Where they are detained, we will then take them to a health place base of safety in order for them to seek that specialist medical care that they require at that time. As the Chief's pointed out, yes, we are happy in relation to the extra funding that will be going into mental health, because certainly one of the impacts that we have is in relation to the delays as we're handing over that individual to the experts within that health place of safety. Because on occasions there are significant delays, and certainly what we are doing at this moment in time is a piece of work in relation to understanding the time it's taken us for us to progress those handovers, and obviously we can provide that at a later stage. As mentioned, there is 2 ways now that we can lawfully detain people under section 136 within our police cells. The first one, which is slightly different, is when people are arrested for a criminal offence. When we bring them into the cell complex, If during that time we feel that they need to be detained under section 136, we can basically finalise or pause the pace clock and enter the section 136 legislation. And secondly, and these are very exceptional circumstances, it's when the individual is displaying extremely violent behaviour and obviously cannot be accommodated in with that health-based place of safety. What will happen then is obviously the detainee will receive that Mental Health Act assessment within our custody when they're displaying those signs. And again, sometimes there are delays in relation to their access to a clear bed then within that place of safety. And we have 24 hours in order for us to facilitate that. Where we hit issues tend to be around beds for children, where there's medical needs or they require a forensic bed because of that violent nature at that moment in time. Each district we have escalation procedures, so if we do hit the odd problem, and I have to say it is the odd problem, at a senior level at a district they'll be able to go and speak to the relevant person within health and make sure those issues don't raise their heads again. I think some of the ongoing work and the developments, as I mentioned before, the hub nurses, fantastic access to that information. The high intensity service users, we've been to visit Yorkshire Ambulance Service. They have a fantastic team in relation to dealing with those repeat users of the service, and what we need to do is actually learn from them as in relation to using that. I think there is at this moment in time a trial within Bradford where they are bringing partners in and dealing with their top 10 users of service. And again, what we want to do through the Safeguarding Governance Unit is actually pick that up and replicate that across the other 4 districts as well. And likewise, I know you've had the previous brief with regards to the handheld device. What that's given us is that quick and easy access to the records that we're recording, so we can actually look at how we're actually dealing with people on a regular basis. I think the key thing that I'd like you to take from the report is not only our officers acting correctly in line with the existing and new mental health legislation, but they're also displaying that real bravery and excellence in safeguarding people, because these are people going through significant distress at that moment in time. Another area that we need to look at that we're still not getting right 100% of the time is use of the ambulance. Basically what we should be doing is contacting the ambulance service to transport those people to the health place of safety. We should obviously accompany them because they're still within our detention. And what we're not getting right is just recording our rationale when we're not using the ambulance service, because obviously if they're agitated, we can use our police vehicles to do that, and we just need to get better in relation to the recording of that rationale. One of the things we are seeing is really the demand implications of mental health. I think when you look at the people who are coming through our custody suite now, 43% of all persons arrested have some kind of entry on their mental health risk assessment. That can range from anything from depression right through to serious mental health issues. It used to be a lot lower 2 years ago, but certainly from my point of view, I think where we've gone through society, people are more willing to speak about mental health issues now. So I think people are disclosing the issues a lot earlier. So certainly from my point of view, I think the success that we've shown in relation to not bringing people into custody, long may that continue, but it's still showing significant demand requirements on our resources at this moment in time, Commissioner.
Yeah, no, thank you. That's a good update report into this area. And before I get into any questions, I absolutely do recognise the work that's gone into this by not only colleagues in West Yorkshire Police but a range of partners. So it is good to see the progress that has been made. But I will follow on with some questions. So obviously continue to recognise and welcome the numbers within the report regarding process through custody suites. As you say, only sort of exceptional circumstances, which I'm aware of, at least a couple of those regarding some of the case conferences that have happened. I guess one of the questions, and it's sort of bottom of page 1, so we've got the table there that sets out the monthly figures around detentions overall. Do we have an understanding of the percentage of the age groups and also from the data the BAME communities, and if they are overrepresented potentially in some of those figures.
Yeah, yes, certainly. I think when you look at it, certainly for those people who are under the age of 18, the numbers are minimal. Out of every 100 occurrences that we deal with, approximately about 7 of those are in relation to people under the age of 18. And certainly when you look at BAME representation, unfortunately, when you look at the figures, it has risen from 9% up to 18% in relation to those people that we are dealing from that BAME background. However, when you look at that on a graph, the numbers have slightly fallen in relation to how many BAME are coming through under Section 136. The reason it's jumped up so, by such a proportion is when you look at those who are white, it has fallen quite drastically. So BAME numbers have more or less stayed the same, but those who are coming through Section 136 for white have fallen quite considerably. So there's a little bit more work to be done in relation to the Safeguarding Governance Unit there, just to see why the same level hasn't reduced within BAME.
So 5 years ago, we were probably having around about 1,200 interactions for Section 136 in terms of the white community and just under 200 for BAME. Fast forward to last year's figures, we're talking just over 600 Section 136 interactions with members of the white community and a similar kind of just under 200 for BAME. And of course that's based on the declarations and so on that people make about ethnicity and so on. So the overall numbers hasn't gone up, it's just that because of the differential, the percentage has gone up.
Okay, yeah, so there's more work to do to understand what's behind that then, potentially.
Well, fundamentally, the numbers for our BAME communities are relatively low, and particularly when you think about the population across the whole of West Yorkshire. But again, there's some further work to have a look at. How does that compare nationally and so on?
Yeah, okay, thanks for that. I mean, again, still on page 1, there's a reference to the creation of records on the police computer. Are there still some issues with that? Is it
the only issue in relation to that, Commissioner, is in relation to the officers actually completing the update on the handheld. And I think, if we're honest, the only place where we're having issues is where there's a handover in relation to being sat at the health-based place of safety of officers, because there's a delay of officers then coming in to take over because we're getting the officers off duty. So there's just that. Have the officers who dealt with the incident at first completed it, and if not, have those who are handing said person over to the health people actually completing it. And at the moment what we're doing is we're capturing that through Storm. So if we look at Storm and then we look at the systems, if we're missing, we're then going back and getting it retrospectively. What we need to be in a position is we're quite happy that it's been done at the time. So there's just a little bit more of training in relation to that, and updating in relation to the handhelds, making sure it's done at the time.
Otherwise it looks as if it's taken longer for them to have got through the process, and of course that's not fair when we're having conversations about timings.
So it's more around training rather than technology issues?
Yeah, because we've got the technology, we've got it on the handhelds, it's just making sure that it's completed at the time.
Okay, thanks. And then you have, to be fair, set out some of the figures around under 18s, but could you sort of say more about what a response might be to someone under 18 who's in that position of experience of mental health?
Yeah, certainly, Commissioner. I think the initial contact from the police is no different, because obviously as the call comes in, as we interact with the individual, that there is no change in that. I think if we're perfectly honest, the issue that comes with people under the age of 18 is access to their medical health records. So as I previously explained in the update, anybody over the age of 18 will pick up the phone, contact the hub nurse, and they'll be able to access those records straight away. With a child or somebody under the age of 18, you can't do that, and the officer would have to contact the local CAMS unit in hours to gain access to that. Out of hours, we are then struggling. So there's a lot of work being done centrally through the Safeguarding Governance Unit, working with our partners, because they accept this is an issue about how do we access children's records in exactly the same way, 24 hours a day. Because if I'm honest, at the moment, the whole process and certainly the medical health provisions are all set up for adults. So when we do access that, if it's decided that the child should be taken to that place of safety, they will still be taken to the same place of safety as an adult would be taken, because that's the provision that's in place at this moment in time. So the only issue at the moment is access to their medical records.
And you might be aware we've set up a West Yorkshire appropriate adult scheme. Is any of that relevant to these types of cases, or is it mainly to do with what you just described?
No, it would have been previously, before the law changed and when we were waiting for the mental health assessment within the custody suite, because obviously you have to have an appropriate adult present at that moment in time. So at this point in time, no, it doesn't affect it. It's just purely accessing those records.
Right. So we're working on protocols with...
We are working on protocols with partners, and the partners are fully committed to that as well.
Okay, thanks. Page 2, so the table there, I know you did say, talking about Leeds having the most numbers, and it is clearly the biggest district within West Yorkshire, but it still looks a little bit disproportionately higher. Mm-hmm. Is there any reasoning behind that?
I'll be honest, I think when you look at that table, you're not comparing apples with apples, and the key thing that we do look at on a regular basis is the actual national picture, and also using health data, which is much more accurate than police data. And when you look at Leeds as a large metropolitan city and compare that with cities of a similar size demographic, they are on a par. So we are quite happy that there isn't an overuse of Section 136 within Leeds at this moment in time.
So does that mean the other ones could be lower than anticipated?
No, again, when you look at those, again, comparing apples with apples, it's a very similar within percentages, so we're quite happy at this moment in time.
I think it needs to link into your first question around white population, BAME population. My kind of gut instinct is that we've got a lot of underreporting in the BAME communities across West Yorkshire.
Okay. So the areas of Calderdale, Kirklees, Wakefield are covered by the South West Yorkshire
Foundation Trust.
Perhaps, yes. But again, well, you might have just answered it, but as I've said, it's maybe down to the underreporting them. But I think we've looked at some of the out of hours figures, and do you think that's an element around putting some of the officers are put off, if you like, around the needs around some of those cases?
No, I think when we look at it, we are doing, as I mentioned within the report, we're doing another piece of work in relation to waiting times, the handover time, shall we say, in relation to handing it over to the healthcare professionals. And certainly within those areas, they have some of the better figures compared to the other districts. So in relation to actually having to take somebody, Section 136, to that place of safety, they are dealing with it in some of the areas a lot quicker than the others as well. So I'm quite happy that they've got the 24/7 access to those hub nurses and actually to the place of safety as well.
Okay, well that's good to hear, because that, I think the perception around that certainly wasn't that a little while ago.
Yeah, I think it goes back to one of the reasons why Leeds is perhaps so successful is because the Beacon Centre have been working with these principles for a very, very long time. Other areas had to get up to speed relatively quickly because of the change in the legislation. So, of course, there's inevitably been some teething problem potential there. But I think as time goes on, and we'll continue to monitor it, as Damien said, if there are any very, very localised issues, then we'll go and meet with people and have those conversations.
Yeah, and as you say, the work that's been done in Bradford, which I did visit the team up there fairly recently, there's some excellent good practice that hopefully has influenced some of the working in those other districts as well. So just at the bottom of page 4, And you touched on some of the research that 43% of all persons arrested have some kind of entry on their mental health risk assessment, which is a stark sort of figure in itself. Do we have any more data to link those mental health detentions who then go on to commit serious or violent crime? And if not, does this form part of the work undertaken, or that will be undertaken by the central safeguarding to improve some of the recording practices?
There is a lot of work undertaken at this moment in time by the Central Safeguarding Governance Unit, because we are looking at how can we make sure that the flags and the recording of markers is the best that they can be. As I mentioned within the update within the report, I think that figure is slightly misguided, because when you look at the 43%, it covers the mental health bracket because it's part of the mental health risk assessment as they come through the door. Yeah. And as I said right at the beginning, it's on a massive scale out, because it can be from, you know, not discounting people suffering from depression, going right through to serious mental health issues. So at the moment, we flag it, but I don't think there's any sort of correlation to say that they go on to commit further serious violent crime.
I would be really worried if we started to have a look at the data that we have from that perspective, because when the individual is brought into custody, they are asked a series of questions about who are you and so on. You are alerted to why you have been arrested and what the offences are that you are being investigated for, and then you are asked a series of questions around your well-being so that we can detain you properly and look after you properly. And this is that point when you're asked about a mental health condition. So there may well be no relation whatsoever to the reason why you've been brought in and the fact that you do actually have mental ill health. And so I'm not aware of anywhere at the moment that is more proactively trying to link the two from custody data. I think it would be flawed. I think that would have to be a separate piece of research if that's what the university or somebody else wanted to consider.
No, I understand what you're saying. It was just trying to, given the issues around violent crime and the increases, it was really just trying to understand if there are any sort of things that we're missing here, or things that leave out that perhaps we're not fully aware of. And obviously some of this is down to the availability of safe places and the other services involved.
Yeah, I mean, you know, absolutely. Of course, you know, mental ill health that has such a wide range of things that people can see or not see, and so on. Just because somebody is suffering from mental ill health doesn't necessarily mean that they might have committed offences. So we've got to be really careful about how we use the data that we collect.
No, I agree. It was just making sure we're not missing anything really within those figures. Okay. Thanks for that good update report, and we'll move on to the next item if that's okay.